Okay, we're back for the last segment of the show, and again, I remind the callers or the viewers that 727-8750 is the call-in number. If you have any questions or concerns about anything that you want to discuss that's medicine, please feel free to pick up the phone and call in, and I'll try and answer your question to the best of my ability. So right before the break, we were talking about dependency and a little bit about it, and some of the older people that basically it was called dope, and they were very afraid of taking a pain pill. Our government did a good job of scaring us in the 30s and 40s in reefer madness, and a lot of that has a lot of political implications. But that being said, I'm seeing a fair number of people actually coming in and getting a marijuana card because they're interested in pursuing that as an alternative to prescription pain medications, and I totally support that. And what they're doing with pain medications today, and how they're controlling them and what they're doing with them, I think that if that's something you're inclined to do, and you do it responsibly, it's like everything else. Privileges are what they are, rights are what they are, and they are not the same thing. Just because you have a right, it is not a privilege to do it any way you want to. So actually, I think if you have a privilege, it's not a right to do it the way you want to. So your rights are basically privileges that you can do how you want to. So that's a topic for a whole constitutional discussion. But that being said, marijuana, the fact that the state has allowed it for certain medicinal uses and if you suffer from those, I encourage you to get legal and get a card so that you can use this substance to help you. And of course, it does take a doctor to be able to do that. I can personally say I don't scrutinize your reason for doing it, but I certainly will not condone you coming in and lying to me about what your reason is just to get a card to use marijuana. It has not been legalized in this state for recreational use. So you do need a legitimate medical reason in order to get that particular card. That being said, obviously, Ray called in a couple of weeks ago and said that someone got in trouble and they yanked his card right away. I don't know much about that, but I will tell you that in that case, you could certainly get a prescription for Dronabinol or Marinol, and that would be very hard for them to pull that from you because it's a legitimate prescription issued by a legitimate office visit by a licensed physician who has the ability to prescribe that product. So you can take that however you want to take that and use it. So dependency, again, is using something for its effect, meaning it relieves that, and no, it is not dope. So there was another slide that was very interesting, and I don't know if my producer will bring it up, but we talked a little bit on the previous show about when you're using products for pain or sleep, what can happen to your respirations while you sleep. And I've had this slide up on here before. The top slide on there shows what happens to someone who basically, this was a overweight person, and this particular person was not on any particular pain medications, but you can look on the left side of the screen and you can see 190 and then 80, 70, 60. That's the saturation of oxygen in their blood. Now, you can see all those dips below the 90, and there's also another line which you really can't see on the screen, but that's 88. So when your oxygen levels fall below 88% in your blood, a lot of changes happen that cause really detrimental effects to what we call the pulmonary circulation, which is a very short circulation from the right side of the heart to your lung. And if that becomes strained, which does happen when the oxygen saturations fall to 88% or lower, it causes a constriction of those blood vessels. And if they constrict long enough, it becomes irreversible, thus limiting blood flow through your lungs and you become short of breath. It's called pulmonary hypertension. And so here is a person who's sleeping, but what's even more important with that is this is someone who's sleeping overnight. So we're measuring the saturation, how much oxygen is in his blood. And you can see that, that it's not listed very well on that top graph, but that's a whole night's worth of sleeping. So this person may sleep an hour and then all of a sudden their muscles relax and they start to basically drift down, and it's hard on their system, so their body wakes them up, and then again they're above the 90, and then they start to fall asleep into deeper and deeper sleep, and then the saturations fall down, and then the body has this natural alarm system that wakes us up when we're starving ourselves from oxygen. And so it wakes us up, and that tightens up our muscles and on our throat and our oropharynx, and we start to breathe better, and then all of a sudden you see again they start to dip down. So in order to feel rested during the next day, you need at least 4 hours of good REM sleep. This person on that top slide did not get any REM sleep for a prolonged period of time. Now, one of the things that causes is basically fatigue during the day, and it also does not allow men especially to secrete testosterone while they're sleeping. Now, that being said, once you become low in testosterone, they become more tired and overweight, which causes more in the way of reduction in testosterone. So if you're overweight, if you have a BMI of 30, over 30, then you have low testosterone, one of the things that could be going on is you're not getting enough oxygen during the night. And if you're young enough to correct that situation, I suggest that you get into your doctor and get that taken care of. Now, let's go back to the slides, because that second slide below that was let's go back to the previous one. Yes, that one. The bottom slide on that particular person was a patient who actually took pain medication. And so what those pain medications do is they actually reduce the work of breathing. They actually slow your respirations down to a little bit, but they also reduce the effort at which you're breathing at night. So it's very important to look at patients on sometimes when they're overweight, plus they have sleeping medication, you get a 1 + 1 = 3. Now we can go to the next slide, and you can see that once I place those two people on oxygen at nighttime, you can look at the difference in their oxygen curves. Basically, just oxygen alone kept their muscle volume and their muscle tone high enough to where they did not desaturate. Now, these people didn't need a mask or a CPAP, and you would have thought by looking at that slide, the previous slide, that was sleep apnea. And I would have thought so too until I started placing some of those patients just on plain oxygen, and those are the results that you get. So all overweight people who have short necks and broad shoulders, people who basically maybe even smoke, or people who basically take pain medications should be tested by their doctor, especially if you have any type of fatigue. And that's the part that I'm trying to explain to people in a lot of things. It's just making sure that if you're driving to Vegas and you're doing those things and you're falling asleep during the middle of the day, you may need something like this. And certainly if you're feeling, if you go into the doctor and he checks your testosterone, one of the things they should be doing is also checking your ability to breathe at night. And that being said, it's a very simple test. It takes a little bit of time in your home, and paying for oxygen is something most insurance companies do cover very, very well if you do qualify for it. Now, you have to have 5 minutes of saturations below 88% in order to qualify for oxygen at night, and that's not really that hard to really obtain. So very important for people to think about those particular things. We see a lot of overweight people. Obesity is a real problem in the United States, and that's probably affecting a lot of our ability to sleep. Now, I know some patients, when I tell them about this test, they sit there and they say, well, I sleep very well. And I look at them and I'm saying, really? Are you watching how you're sleeping? Do you really know what you're doing? Well, the obvious answer is no. And we do this test, and then once we place them on oxygen, after we find that they need it, they have really, really enhanced their level of alertness, their level of energy. And so it's one of those things, a very common cause of chronic fatigue. And again, I've said it before, I do not like chronic fatigue syndrome. I know a lot of people talk about it, and they use this thing called Epstein-Barr virus, and they will check your titer, and they will say, oh, your EBV titers are elevated, so therefore you have chronic Epstein-Barr virus. That is absolute malarkey. Okay, your body remembers the Epstein-Barr infection that you had at a younger age, which would be mono, and if you get tired and your immune system gets revved, you will rev up more antibodies, because that's what happens. And whenever you get a cold, you're going to make antibodies to every cold you ever had and processed. That being said, you always have the memory of Epstein-Barr virus, and so those titers may go up and they may come back down, but that is not chronic EBV until someone comes out with a test for the actual viral load or the actual virus itself. When they do that, then I might be a believer in chronic Epstein-Barr virus. But until then, it's a wastebasket diagnosis. It really has, in my mind, no place in medical literature or medical milieu, because it really doesn't work in that respect. There's really nothing behind it. So if someone says you have chronic EBV, I think they're just putting a label on your chronic fatigue. They probably need to check your oxygen levels at night to make sure that you saturate very well. And there are a lot of heart disease, heart attacks, and other things that can happen from having low oxygen, as well as having hypertension. That's what I don't like glyburide, which is a diabetic pill that you take at nighttime. It forces your sugar very low, but because it's cheap, the insurance companies love it, and it's the first line drug. But if you're sleeping and your blood sugar is dropping very low and your body has to wake up, you become very hypertensive, and they think that that's one of the things that causes some 6 a.m. or 5 a.m. heart disease in people. So I covered a lot of topics tonight, and again, I thank you for tuning in. I will hopefully be back actually I will not have a show next Monday because of the holiday, but I'll be back the following after the week. There will be a rerun. Thank you for tuning in tonight.